Record. All right, so we are good to start. Dr. Craig, thank you so much for being with us today, and I'll let you introduce yourself and give you the floor.
Sure, thank you. I appreciate you, Angela. So my name is Dr. Craig Sidol. I'm a licensed clinical psychologist. Um, I earned my degree from the University of Cincinnati, and I did my internship at Kennedy Krieger Institute in Baltimore. And I did my postdoctoral work at the Cincinnati Children's Hospital. And since then, I've continued to work specifically with kids and adults with ADHD. I've opened up my own practice, the Mid-Atlantic Center for ADHD. Um, that's out in Westchester. Um, this talk is supposed to be about parent training, right? Slash parent coaching. Kind of what is it? What's the difference? Why do we need it for kids? And then, I'm going to walk through some exercises that you might get through in some of them. I'm happy to have any of you kind of jump in with questions as we go throughout this. Or if you want to save your questions to the end, that's fine too. Um, so when children are diagnosed with ADHD, a recommendation to engage in parent coaching or parent behavior management training is often provided. In this session, I'm going to talk about what it is, why it's necessary to improve the symptoms of ADHD, and like I mentioned, you'll learn some strategies. So I'm going to go ahead and share my screen, and hopefully everything works out well with this. Uh, let's see here.
Did we make you a co-host?
I don't know if you did.
Okay, so
Let's see. Can I share? Oh, sharing
individual.
not turned on. I'll send the request.
Okay, thank you. Okay, you should be able to do it now.
Right, so I'm going to share, and it should come up shortly. Is everybody able to see that?
Yes.
Great. All right. So, this is the another photo of me. It kind of talks through, like I said, all my training. Additionally, I have some research interests in just ADHD in general, but how it combines with sleep, parent training, and then the summer treatment program. So we're going to talk a little about what ADHD is. We're going to talk a little bit about, some kind of what behavior parent coaching is, what behavior management training is, and then we'll go through some different activities. Okay. So, what is ADHD? If you're on this call, you probably have some idea on what it is, but I just like to kind of go through it. It's a persistent pattern of developmentally inappropriate levels of inattention, hyperactivity, or impulsivity. The one thing I definitely want to, kind of draw attention to is the fact that, with inattention, a lot of these kids and adults are forgetful, right? So why parent training is often recommended is because if your child goes into, an hour-long session with a provider, a therapist, right? And they talk about all these different strategies. One of the things that happens most is your kid leaves that office and you say, "So what'd you talk about?" And they say, "I don't know," or "I forgot." Um, so that's a big portion of why having the parents involved in treatment is important. All right. I also like to do this in every talk that I give too, because I think it's important to know. So here we have, the earliest known description of what is now called ADHD was in what year? So if anybody wants to throw out a year, that's fine, or you can drop it in the chat. But it was done by a guy named Melchior Wakeard, if that gives you any tips on, when you might place this. Um, it was then followed up by Alexander Crichton in what year, and then George Still in what year. So I'm going to go ahead and um, it was in 1775. So why I like to point that out now, yes, this is what we now call ADHD, so they didn't call it ADHD back then. But I like to point this out because a lot of parents will say things, or a lot of adults or teachers or somebody will say something along the lines of like, they didn't have this ADHD thing when I was a kid, right? And that's true in some aspects. It's true that we didn't call it ADHD. It's true that we weren't as good as diagnosing it, or it's true that, we didn't have enough services for, these individuals. However, we've been talking about ADHD for, quite some time at this point. And I think that's important to know. This isn't something new. This isn't something that suddenly came about in the late 80s or the early 90s. The next thing I have here is the first study that examined stimulant medication in children at school with attention problems was published in what year? So go ahead, kind of take another guess, right? Kind of think about, what you might know about medication in terms of, how long you think stimulant medication has been prescribed for kids with ADHD. Um, and here we go. It was in 1935. So again, why I like to share this is because a lot of families that I work with will say things like, we don't really know what these medications do, or I don't want my kid to be on medication because they don't need it, or, um, I don't want any of the negative side effects that are going to come along with it. Now, don't get me wrong, some of those are valid concerns, but we know a great deal about stimulant medication. Stimulant medications are the number one research medication that are out on the market today. We know a great deal about these things. We know how they're going to interact. We know about how long they're going to last, and we know what they'll actually help with. In 1980, these problems were first officially called attention deficit disorder, ADD. Okay. And then in 1994, ADD was renamed into ADHD, attention deficit hyperactivity disorder, with three subtypes. Now we use three presentations. So there's inattentive presentation, there's hyperactive impulsive presentation, and then there's combined presentation. Why I like to go over this point is because sometimes I talk with a medical provider or I talk with a parent who puts me in touch with their medical provider about the fact that their child has ADD. And if a medical provider is still calling it ADD, at this point, they are 30 years behind, right? So these just might be some ideas of, are you working with somebody who's truly an expert in the field? Are you working with somebody who knows what your child needs out of this? I'm not going to go too much in great deal about it, but if you haven't heard about Barkley's model of ADHD as well as executive functioning, it's definitely something to, look into. So take a screenshot of this, come back to the recorded session of this, and kind of use this to look more into it. But the number one thing here that I want to highlight is that it's just challenges with self-control, right? And because of these kind of components of executive functioning, that's why a lot of individuals have challenges with self-control. So what is self-control? I think a lot of people know in general what it is, but it's the ability to exert this conscious control over our own behavior based off of what's going on in the moment, combined with our past experiences, as well as our expectations for the future. However, a lot of individuals with ADHD, they have some impairments in this stuff. So it leads to difficulties with being able to follow through with tasks to completion. It often results in engaging in the same pattern over and over again, even though it's not working. Um, it often is less likely to return to a previous pattern after short disruption. So maybe, you have somebody who's getting to bed at the same time every night, every night, every night, every night, and then they get sick and suddenly they're not going to bed at the same time every night. Or you have somebody who's doing a great job of, completing their homework, and then all of a sudden a break comes up. They're on spring break, and then they get back into it and they're not on top of their homework like they used to be. And then it can cause challenges with using past experiences to guide decisions in the moment, right? So if people have difficulty with all of these things, right, what's it going to look like to be in one-on-one therapy with a young kid who's going to have even more challenge with this stuff? Well, this is what it's going to look like, right? So this is the comic of Calvin and Hobbes. So if you're not familiar with it, Calvin is a clearly classic kid with ADHD. So in the comic, Calvin says, before going down a steep hill like this, one should always give his sled a safety check. Hobbes says, right. Seatbelts, none. Signals, none. Brakes, none. Steering, none. Whee, right? They just kind of take off, right? And it's, they kind of know that some of the resources that they need aren't there, but they just move forward anywhere. Anyway, in this specific example, pretty impulsive thing to do. But one thing that Russell Barkley says is that ADHD is not a disorder of knowing what to do, but of doing what one knows. And I think that that's really, really important. So I'll give a couple examples of what that might mean. Let's pretend I'm working with, an 8-year-old kid, and we're playing catch, and there's a road nearby. And I ask them before we start playing, hey, what should you do before you cross the street? They're likely going to say, I should look both ways. I say, that's right. That's awesome. So then we start to play catch, and I'm throwing the ball back and forth, and all of a sudden I throw it over their head. They're likely to run across the street, pick up the ball, run right back across the street. And then I'm going to say, hey, what are you supposed to do before you cross the street? And they're going to go, oh, I'm supposed to look both ways. right? They knew it ahead of time, they knew it after the fact. They just really struggled to slow down and use that skill in the moment, right? Many people will describe the ADHD brain as a Ferrari. It goes 0 to 100 super fast, right? In terms of self-control, they have bicycle brakes. So they just rip right through them, you know? And kind of my job and what, my job is when I work with parents to do is it's to work on putting down speed bumps. So your kid can still accelerate pretty quick. They can't go over 20 miles an hour. So let's talk about what is parent coaching. Well, in terms of who does parent coaching or who's able to do parent coaching, um, there's licensed clinicians like myself, and sometimes there's unlicensed individuals, people who are parents themselves who run their own business. Sometimes it's people who have gotten a coaching certificate. Sometimes that person has advanced training or advanced degrees. Sometimes they don't. What's the structure of parent coaching? Parent coaching, excuse me, tends to be pretty flexible and collaborative. So the parents meet with just the provider, right? Kid doesn't have to be involved. It's just the parents and the provider. And that coach works with the parent to figure out the approach that they think might work well for that child. And in terms of how long this lasts is it can be ongoing. It can be we meet every week for the next year. It can be we meet every other week, or it can be we meet for a little bit and then you guys take a break and we meet again. The focus areas of parent coaching tend to be whatever the parent wants to focus on in that session. So maybe it's your own emotion regulation. Maybe it's how you're dealing with being not only a parent, but also you're trying to parent your kid as well as the grandparents on how they should interact with the kids, right? The target audience is parents of all children. And this person sometimes specializes with kids with ADHD. So I think it's important to note that if you're going to look for a parent coach, you want to make sure that they actually work with a lot of kids with ADHD. And if you want to work with the person who works with a lot of kids with ADHD, find out how long you think you'll work with them, right? Because here's the really kind of big catch for a lot of people is that typically working with a coach is not covered by insurance, right? So if you're going with some of these unlicensed individuals, even though they might be a coach, they might have some certifications, they're going to bill you out of pocket, and you can't submit that stuff to reimbursement for insurance. Um, so just kind of keep that in mind. Now, we'll get to this in a little bit, but sometimes licensed clinicians like myself can also do this, and you're able to submit, either bill insurance or submit claims to insurance. So now let's talk a little bit about what parent behavior management training is. And this is the number one recommendation for kids with ADHD, right? So if your kid's just been evaluated, or maybe you've been having some challenges since their evaluation, this is the number one recommendation for them to do, or for you to do for them. Um, Licensed clinicians are the ones who do parent behavior management training. What's the structure look like? This is highly structured and skill-based, meaning that we're focused specifically on your child learning skills. What might those skills be? Some of those skills are things like emotion regulation. Some of those skills might be things like time management, organization. It might be things like following through with routines or demands. Um, it's also typically time limited. So when you go to work with somebody in parent behavior management training, they'll say, this is about how many sessions we're going to work together. We're going to work together for about 8. We're going to work together for about 10, right? Typically, when families come to work with me for both parent management training and coaching, it takes about 12 sessions. Sessions also implement evidence-based strategies proven to work for kids with ADHD. So unlike a coach who might say, hey, these are just some things that I think might work, parent management training is this works for kids with ADHD. Why do we know that? Because we've studied it. We've studied it on hundreds of kids with ADHD, and we've implemented it for hundreds of kids with ADHD. What's the focus area? The focus area is to set clear routines and expectations, right? So sometimes parents think that they are really good at setting the expectations, and sometimes they're right with that. However, sometimes where they struggle is to implement consequences consistently and immediately. A lot of parents might struggle. Every once in a while, they do something different, or the consequence comes 20 minutes later, or it comes when the kid gets home, or it comes at a very different time point. Who is the target audience of parent behavior management training? Well, the target audience are parents of children with ADHD or disruptive behavior. Okay. Because this is a very skill focused approach for these families. So this slide is just going to be helpful, maybe as you kind of break it down, thinking about what you're wanting in terms of treatment. Um, again, this main goal is to reduce challenging behaviors using specific strategies. So things like non-compliance, things like interrupting, things like difficulty managing their own emotions. It's manualized, time structured, right? This is just kind of more holistic stuff. What do you want to get as a parent out of this? Do you want me to support you just to hear how tough it is to have a kid with ADHD? Um, okay. So which approach is best? A lot of parents will come and ask this, and I think, it can be challenging to say, but working with a clinician who can integrate both approaches is probably your best bet. It's often best to start with parent behavior management training to decrease some of these behaviors, right? Get your kids' emotions under control, allow them to kind of follow through with directives and routines. Great. Once you've kind of managed that, then we can move on to some of the other stuff. We can move on to some of the low hanging fruit. How do we, now that your kid manages their own emotions, how do we build back a good relationship between you and your child? Or, you know what? Now that your kid is able to manage their emotions, how do we make sure that they're eating healthy? Right? That's the coaching part that can come in. So it's important to discuss with the clinician your goals, right? What are you trying to get out of this as a parent? And when you do this, I highly recommend making sure that you get as specific as possible. you know when I work with families and they come in for that first session, we'll talk about a child getting upset, and normally parents will say things like, I want my kid to be able to manage their own emotions. Well, what does that look like? Does that look like your kid being able to accept no? Or how about being able to ask for help? Being able to take time to themselves to calm themselves down, being able to um, still get frustrated, but manage it within a few minutes rather than several minutes or, 20 or 30 minutes. That's that's the goal. So when I work with a parent and they want to work on something like their kid getting upset, I find out, how often is your kid getting upset? How long is it lasting? And on a scale of 1 to 10, how intense is that for you? Great. What do we want that to look like in a few months from now, kind of at that 12 session mark? Well, I think it should be at a scale on a 1 to 10. It should probably be at a 3, low level stuff. I want them to be able to manage their emotions in about, 2 or 3 minutes, and I don't want them to be aggressive when they're doing it. Awesome. Now we can be on a clear path. And you might say something like, once we get that under control, I want my kid to eat more vegetables. Awesome. Great. We can work on that after we get them to manage their emotions. So now I want to talk more about, the parent behavior management training and the principles that it uses. So these are behavioral principles. So it goes off of what's considered the ABC model. Okay. So things to keep in mind when your child is exhibiting some, challenging behavior is, first of all, where is this happening? Is this in your home, at school, in public? Is this a familiar place, an unfamiliar place? What else do we have going on? And then think about the antecedents. What was everything that took place before that behavior? So for example, a child is in class and the teacher presents a new topic. The behavior is then what your child does. Example, they raise their hand and ask a question. And then the consequence is anything that occurs after the behavior. So the teacher clarifies the new concept, the concept. I want to be very clear that consequence just means anything that comes after. This isn't just all the bad consequences, right? These are good consequences too. It can be, what happens when I show up to work, I get paid. That's a great consequence for me. So we want to have consequences for desired behavior and then also consequences for non-desired or disruptive behavior. The other thing that behavioral principles focus on is the types of consequences. You know, how are we using consequences? Are we using consequences to reinforce or are we using consequences to punish? So reinforcement means that we're trying to make the behavior more likely to occur in the future. And we can do that in two ways. We can do that through positive reinforcement, meaning we're going to add something in to the environment. So it's what we typically think of as rewards. So this is stuff like praise, high fives, earning a privilege. Maybe your kid had a sticker chart or tokens or money or something like that. Can be things like screen time, right? Negative reinforcement is we're going to increase the likelihood of a behavior by removing something, removing an expectation or removing a demand. So sometimes this can accidentally reinforce a behavior that we don't want. In this example I have here is kids being removed from class often doesn't work as intended because if you don't like the class and then you're pulled out of it, great, what you learn is get disruptive, act out because I'll kind of move out or miss out on some of the material. Types of negative reinforcement are things like a later bedtime, soothing a child, removing a chore, or an alarm clock noise. Now let's talk about punishment. Punishment, the goal is to decrease the likelihood that behavior occurs. So positive punishment is adding something in, like chores, or spanking, or writing lines, or giving a reprimand or a lecture. And this is crucial, although it might stop the disruptive behavior in the short term. Positive punishment is most often ineffective in improving the behavior of children with ADHD over time, and it often leads to more disruptive behavior. Why is this? This is because the ADHD brain takes risks. And if sometimes it results in chores, and if sometimes it results in a lecture, the kid's brain is most hopeful for the lecture, right? Negative punishment is removing something in order to make the behavior less likely to happen. Things like timeout, paying a fine, taking away a toy, or plan ignoring. This is crucial. Negative punishment can be effective as long as the privilege lost is something that the individual values and is temporary. So many adults that I work with, when their kid, kind of raises their frustration, is not listening, is not listening, is not listening, or continues to be upset over a situation, a parent will say something like, "That's it. You lose the video games for the week, or you lose screen time all weekend," right? That's not the kind of temporary that we're talking about. That doesn't leave your child in a place where they still want to work for you. Imagine if, you went into work on Monday, but you showed up, I don't know, an hour late. And if your boss said to you, "We're not paying you for the rest of the week," if I had to guess, you'd probably consider not going in the rest of the week since you're not going to be paid. But because you have the opportunity to be paid for Tuesday or the rest of Monday, you do show up, right? And that's how we want things to work for your kid. We don't want to take them away long term. Some of this stuff is more helpful if we have it them working towards earning screens rather than losing screens. In terms of the four functions of the behavior, these are kind of the motivation, why we engage in anything. So the first is tangibles. This is like stuff or privileges. So things like money, screen time, being able to go out to a specific place like, the park or laser tag or bowling. That is really cool, so a lot of kids work for that. And adults, right? In terms of attention, this is, stuff like how other people are noticing us. In my life, I'm primarily motivated by attention for good stuff. I'm in this job because people told me, "Hey, you do pretty well at it," right? I tell certain jokes because people laugh. Sometimes kids engage in disruptive behavior because they get reprimands or because their adults start to pay more attention to them in that moment, right? So things like yelling or corrections can often still be attention in that. We also do things to avoid, meaning we put something off, or we escape, meaning we get out of using a specific skill, right? So doing things like sleep in, we avoid getting up. Going to bed later, we avoid, getting to bed on time. Skipping chores, parents doing the task for them means they get to escape, or they're given the strategy to solve the problem. Classic thing is I'm bored. Parent says, well, why don't you go outside and ride your bike? No. Well, why don't you go outside and shoot hoops? No. Why don't you see if any friends want to come over? Okay. We just help them escape the skill of trying to manage their own boredom. The last one here is automatic, and we do things because it feels good. It's the release of kind of the neurotransmitters, the dopamine, the epinephrine, the norepinephrine, right? So I do things like I'll hold the door open for somebody just because I'm a nice guy and I like doing it. I don't need somebody to give me $5. I don't need the thank you. I'm not trying to avoid a comment from them. I just do it because I feel good about it. And a lot of parents want their kids to do it because of this stuff. However, we have to motivate them through these three first, this external motivation. And again, that's why having parents involved in the treatment is so crucial. We need to change the environment around these kids so that we can make sure that the motivation is there to help them out. So why does disruptive behavior happen? Well, often it happens because adults have a plan. And I have plan in quotation marks because that plan usually isn't very good. That plan is something like my kid will listen or my kid will behave, right? Adults tend to be outcome focused rather than skill focused. Is my kid behaving or are they not behaving? Is my kid listening or are they not listening? Versus, is my kid learning how to manage their emotions? Is my kid learning that there are consequences for not listening, right? Most strategies that we employ tend to be responsive. We wait for the child to do something and then we act. We also have varied responses to the same behavior. Sometimes we give lectures, sometimes we give reminders, sometimes we take things away, sometimes we threaten to take things away, sometimes we offer a bribe, sometimes we forget about the demand that we issued in the first place, sometimes we do it for them because it's the 30th time that I've asked him to move his shoes, so I'll just move him for him, right? Consequences sometimes inadvertently reinforce the disruptive behavior because we think our strategy worked. And it may change the behavior temporarily, like I mentioned, but it's likely to ensure that this disruptive behavior occurs again in the future. So today I want to talk a little bit about demands, right? And I think it's going to go in pretty well with the school refusal type stuff. And, I'm happy to talk more about that towards the end. But a demand is our expectation for a behavior to occur. Right? An example of the demands are things like routines, this forced choice, you can either do this or this. It can be a command, you tell them to do something, a question, you're asking for a response like, hey, how was school today? You want them to share something with you. You're not okay with them just walking away. Demands can be reprimands because you spilled that, you need to do this. And demands can be either given verbally or written. Something to keep in mind is that we all have a threshold of demands. Right? When you're overworked at work, at home, and whatever else you got going on in your life, you tend to be more stressed, and the same is true for kids. So our goal is to make sure that they're operating below their demand threshold. Okay, where can we keep them at so they're more likely willing and able to comply? So to understand demands, first, why do we comply with demands? Well, I want to earn a privilege or a thing. I want to get positive feedback from the fact that I complied with a demand. I want to get it over with, or I want it to feel good, right? Having completed the things. In terms of why we don't comply with demands, one, maybe we're still able to do something else. You tell your kid to come to the dinner table and they're still playing on their tablet, right? They don't want to listen because they're engaged in the thing that they want to do, right? And then sometimes, or no, I shouldn't say sometimes, why people don't comply with demands is because they get to avoid or escape. They get to do it later. Maybe it's on the 10th time you told it to them. Maybe they do it after you yell. Maybe they do it after you threaten something. Or Like I said, in the shoe example, maybe you just end up doing it for them or you forget. So how we can manage some of this stuff is by implementing an effective routine. So first, I want to talk about what an ineffective routine might look like. Okay, so we know that school starts at 8:30. And in quotes here is kind of the plan that I have is that the child will complete the routine on their own or with some assistance. And then our expectations for the kid is that they have to get dressed, they get to eat breakfast, they have to brush their teeth, they have to pack the backpack, and they have to put their shoes on, and that they have to leave for school by 8:15 or we're late. So if your kid works on their routine, most likely parents do one of three things. They give their kid praise. But what's more likely to happen is they give no attention because this is what an 8-year-old is supposed to do. Or this is what a 13-year-old is supposed to do. They're supposed to get their routine going. So we don't mention any of that stuff. Or we give a negative comment. We say something sarcastic, or we say something disparaging. Oh my gosh, look at you. You can get ready on time. Or, wow, I only had to tell you 15 times to get ready this morning, not 24. So your kid just did something that's hard for them, and they end up, getting a little bit of flack for it. When they're not working on their routine because they're distracted, or they're playing, or they're slow, or they're making low effort, or they're asking questions, or they're just having difficulty with transitions, we do a variety of different things. We give reminders, we raise our voice, we talk to them about what they should do, we talk to them about what they should not be doing. We give them a specific strategy. You should go upstairs right now and grab your backpack and bring it right back down right now, right? We threaten the loss of privilege. If you can't do this, you're going to lose TV for the rest of the week. Maybe there is the loss of privilege because you aren't doing it. You lose TV for the rest of the week. Or we bribe. Look, if you get it done right now, we're going to stop at Dunkin' Donuts on the way and get some donuts. And what ends up happening is this goes with everything that I said. When parents don't have a really good plan, um, we often see it come this way first. They come through noncompliance. We do all this stuff. And why we do this stuff is because we're trying to drive your kid back to compliance because we're outcome focused. Is my kid getting this routine done? And then, even after we drive them back, that's what is going to make us more likely to engage with one of these two responses rather than praise because we're so frustrated, we're so annoyed that we're running the exact same play that we did yesterday. And that's the final thing is that we're responding to your kid the whole time. Back and forth and back and forth and back and forth. And that's just not super effective. So let's talk about what establishing an effective routine looks like. So first, we need to know, does your kid have a skill deficit or a motivation deficit? If it's a skill deficit, then we need to practice that thing. How you can kind of determine whether or not it's a skill deficit is, would your kid do it for their favorite thing? If you said, look, if you get your routine done by 8 o'clock this morning, I'll give you $100. If your kid can do it, it's not a skill deficit, it's a motivation deficit. If your kid can't do it for their favorite thing, then it might be a skill deficit. Maybe your kid really is having difficulty with, um, knowing how to put their clothes on, right? Young kid, right? Can't zip up his pants or zip up his coat or something like that. Sure, then we might not expect that until we teach them how to do it. Other things we have to do is we have to make sure that we identify our own timeframes. The goal in all of this is to be smarter than your kid, right? Because your kid's goal is to confuse you. And we'll talk about that more in a little bit, but that's their goal. We want to be clear about expectations, which most parents are. But then the last piece is to follow through with consistent consequences consistently and immediately. So let's talk about what an example of an effective routine might look like. School starts at 8:30, right? That's the same as the last thing. And then we say, look, if the child gets dressed, eats breakfast, brushes their teeth, packs their backpack, and puts their shoes on by 8 o'clock, then they earn 15 minutes of free time. If the child does not complete the routine by 8 o'clock, then they do not earn this free time. And our goal is that we are then going to leave at 8:15. I'm going to point out a couple things that I have in here, which is that I have them actually with their shoes on because I want them to be fully ready when 8:15 hits. I don't want us now looking for shoes, right? So let's talk through what happens if your kid complies with the routine. If your kid is making any effort towards this routine, they are working on all of these skills: task initiation, transitioning, time management, thoroughness, responsibility, and being helpful. So when your kid is doing this stuff, sure, you've learned about this as a parent of a kid with ADHD, you got to catch them being good. You got to tell them that they're doing an awesome job on it, but talk about these skills. I like that you got up immediately when your alarm went off. They finish eating breakfast and they go to the bathroom to brush their teeth. Great job transitioning right away to the bathroom. If your kid's, a little bit older, they're more of a teenager, they don't want to keep hearing good job or I love this or you're doing fantastic, just talk about what's happening. I see that you transitioned right to the bathroom. I noticed that you had everything ready on time, right? We're also going to say then, because you completed your routine by 8 o'clock, you earned your 15 minutes of free time. This language is key. Because you completed your routine, does a couple things. It emphasizes their effort, right? Kids with ADHD sometimes struggle to persist in challenging tasks. So when we are highlighting that they're making effort, they're going to want to keep doing it. When we say by 8 o'clock, we're emphasizing time. Time management is hard for kids with ADHD. Time blindness is a thing. So if we make them more aware of it, that's going to be helpful. And then when we say you earned, we're highlighting their effort related to the outcome. Okay? When I say you get to have screen time now, or you get to have free time, it implies that I'm giving it to them. I'm not. They earned it. If they don't do the things, they don't earn it. Non-compliance with the routine, we're not going to give any reminders between when the kid gets up through 8 o'clock. Well, I don't want you to give any reminders because that's what your kid wants you to do. Your kid wants you to keep giving reminders because then you are the one who keeps track of time. You're the one who keeps track of everything else, right? They don't have to use that skill. They get to avoid it. And I want you to withhold attention because the skill that we're going to focus on here is problem solving. At 8 o'clock, you will then say, because you did not complete your routine by 8 o'clock, you did not earn free time. Couple of things that I don't have on this slide, but I'm going to talk through. 8 o'clock means 8 o'clock. It doesn't mean 8:01. It doesn't mean 8:02. It means 8 o'clock. So if at 8 o'clock you start to say, because you did not complete your routine, and your kid runs across the room and grabs his lunch and throws it, LeBron James, Steph Curry style into his backpack, and says, "I did it, I did it, I did it," it does not count. Close cannot count. And here's why it can't count. Because if your child does it at 8 o'clock, or I'm sorry, 8:01, right? And you say, okay, we're gonna let that happen. You earn your free time tonight or your this morning. Let's cut to 3 days later when it's 8 o'clock and you say, because you didn't complete your routine, and then they scramble and they get everything together in the next 5 minutes. If your kid is like most kids that I work with, they're gonna say, but last week you let me do it. And you say, but last week you were done at 8:01 and you were really close. And they say, well, it's only 8:05 and I'm still really close. And then you're having a conversation with your child about the concept of time, right? Which is just not a place to be. Okay. So 8 o'clock has to mean 8 o'clock. We can't back down from that. Other reasons why it has to be this firm cutoff is because the reward, the 15 minutes of free time, does not come before then either. It only comes after. What we're saying is we're going to pay you the same amount for the same amount of work, right? If I was meeting with a client for an hour and they agreed, we're going to pay you this much money for an hour. If all of a sudden after 30 minutes I said, hey, by the way, I'm done, I think you owe me double. Pretty sure that client's going to look me in the face and say, I don't think I owe you anything. So we want to let the kids know, look, you work hard, you do, and you're going to get the same payment for it. You're still going to get that 15 minutes worth of screens or free time or whatever it is. So if they're done at 7:55, what do they do? Chill, wait, relax, sit on the couch, something like that. Your kids' brains will start to help themselves out and say, it's not worth waking up early. I can sleep in until, 7:40 and I can get all this stuff done in 20 minutes. couple other things here is if your kid is engaged in preferred tasks before them, they are watching TV, they are on a tablet, okay? I don't want you to tell them to turn it off. I want you to walk up to them. I want you to gently take it from them and say, you have not earned this yet. If we tell them to turn it off, we're going to get back in that struggle of, okay, in just a minute. No, not in just a minute. You didn't complete your routine yet, right? So gently turn the thing off. If you can, get ahead of it. Don't have iPads, don't have TV and stuff like that available. If a kid really moves towards the TV a lot, take the plug out of the back of the TV, put it in your car trunk. If you struggle with kids getting on the Wi-Fi because they already have cell phones and stuff like that, turn your Wi-Fi off, change the password, right? Passwords only are earned when they complete these tasks. If your kid then isn't done by 8 o'clock, what we do is we move back in. We're back in parent mode. 8 o'clock, we can move back into nagging. We can move back into, you need to move, right? Because then when your child completes this stuff by 8 o'clock, they earn tangibly their free time. They get a lot of attention from you, from praise. And what happens is they avoid the nagging because we're not telling them anything before 8 o'clock. But if they wait until after 8 o'clock, they get the nagging and they don't like it, right? So we motivate them through all of those functions of behavior. So effective routines decrease the need for multiple demands. Then you don't have to tell your kid this every single day, right? We set them up for success. And then you can use the previous example that I just went through to go through other routines, right? So things like bedtime routines, homework routines, chore lists, stuff like that, right? If you have a homework routine, the best thing for kids with ADHD is do the work first, then get to have fun, right? That's a wonderful process for kids of any age to learn, but especially for kids with ADHD to learn. A lot of parents will say, my kid needs to wind down when they get home from school. I agree with you. Your kid needs to wind down so they can do relaxing activities. They can draw, they can write, they can chill on the couch, they can eat a snack, right? Engaging in video games is not winding down. Being on TV is not winding down. All right, we're going to talk through some examples of ineffective commands. And this is often why kids don't listen, right? And this is another thing that falls under kind of this parent behavior management training. So, again, kind of parents are just in this reactive stage. So parents finish making dinner and would like the child to come to the table. The parent is in the kitchen and the child is watching TV in another room. And the parent says something like, it's time for dinner. Maybe your kid comes to the table, you don't really do much, right? No attention, negative comment, maybe you praise. But if they don't, they continue to play or watch TV. We go through this whole process. And then what do? We're shoving them up here. We're raising our voice. We're losing our cool. We're not managing our own frustration, which then often leads your child to have trouble not managing their emotions too. So how do we use commands effectively to get what we want? If you follow these steps, you're going to have a kid who ends up being more compliant than they are non-compliant. First thing you have to do is you have to state your kid's name to make sure you get their attention. A lot of parents will focus on things like eye contact, or they'll focus on, the kid repeating back to them what they say. That is a really strong punishment type behavior. Getting somebody to look at you, man, I hated hearing that as a kid. I hate hearing it as an adult. You all are looking at me. Maybe you're paying attention to me, or maybe you're thinking about what's going on tomorrow, right? Eye contact doesn't mean you're listening. Repeating back things only sets kids up for failure. You tell them 4 things, they name 3. You say, yep, you forgot the 4th one. When we say their name, we know that we have their attention because everybody's had that experience where they think they hear their name out in public. And the first thing they do is they go, did somebody just say my name? Because we are aware of our name. Second thing you have to do as you're getting started on this is increase your proximity. So you can't give your kids demands more than an arm's reach away. Because if you're in the kitchen and they're in the other room, your kid's brain knows I don't have to do it until you come to me. But if we start right there, great. Then we can slowly work our way farther and farther away. We emphasize that what we mean is what we say, and what we say is what we mean. We have to give it as a statement. Avoid asking kids questions because this models 2 things that we don't want to model. I say something like, can you turn the tablet off? Kid says no. Well, it really wasn't an option. So then I start to tell them, well, why don't you turn it off? We need to eat dinner. What I'm doing right now is I'm modeling that you don't have to accept no, that you can negotiate with your kid. So when we tell our kids no, why do we think they negotiate with us? Because we've been showing them that it's okay. So avoid asking questions for that reason, right? You don't want to get an answer that you aren't, um, you don't want, right? Avoid statements that include things like needs or wants or let's or we or should. Things like we need to clean up. Well, if you didn't make the mess, we don't need to clean up. Your child needs to clean up. So say something like, Joe, clean up your toys. Becky, put away your homework. Avoid comments like wants or needs. I need you to do this. I want you to do this. I would love it if you did, because then we make it about us. Imagine maybe you do have this kid, but imagine, a snotty Netflix, teenager. I need you to do this. I don't care what you need. I need $1 million. You're not getting that. Me that. You know, that's the response that we should think about. So statements should be very clear and directive. Put your shoes on. Put your backpack away. Come to the dinner table. This is important here too. Give it in a start behavior. What do you want to see your child do rather than stop doing? So tell them what you want them to do. Because when we only tell them what not to do, sometimes they can keep doing things that we don't want them to do. A good example of that is I was a lifeguard growing up, right? And if you were on the pool deck and a kid was running and their lifeguard yells out, "Don't run." Well, then what those kids do is they kind of like skip a little bit, right? And then I have to say, "Don't skip." And then they kind of do that weird speed walk thing, that every kid does. And then no, don't even speed walk, right? Instead, say walk. Then we'll get our compliance much more quickly. You're going to go into, maybe you're on, out at a store or something like that, and there's a lot of um, like glass blowing things there, right? And as a parent, the first thing you tell your kid is like, don't touch anything. Well, that's a don't. Instead, tell them what you want them to do. Keep your hands in your pockets. Put your hands at your side. Take 2 steps back. Tell them what you want them to do. That way it sets them up for success rather than for failure. Single step directive, give one direction at a time. Most parents get this. You can't say 4 or 5 things to do for your kids, but something to keep in mind is sometimes we give a directive that we believe is 1 step, but your kid might have difficulty with organizing and sees it as multiple steps. An example is clean your room. If you keep giving the directive, clean your room, and your kid doesn't do it, that's a skill thing, right? But if you say something like, put your dirty clothes in the hamper, and then they do that, awesome. Great. Now do the next step. Put your clean clothes back in your drawers. Take the trash, put it in the, trash bin downstairs. Most importantly, we want to make sure that we follow up with praise. Praise for the skill, not for the action. So if I tell your child, if I say something like, Joey, put your shoes on. If Joey puts his shoes on, I don't want to say, thank you for putting your shoes on. I want to say, thank you for listening, because that's the skill. If I say, get started on your homework and they do, I appreciate you following my directions. I like when you do what I say, right? That part matters because praise does 2 things. One is it tells your child exactly how to get your attention. And 2 is it's an appropriate reminder to keep doing more of it. So if your kid wanted your attention when you're giving them a lot of directives, it'd be really weird if all of a sudden they went and put their shoes on. Mom, look at me. Dad, look at me. I put my shoes on. I don't want you to put your shoes on. I wanted you to keep following my directions, right? So tell them what to do and then follow up with a praise for following directions or listening. Sometimes parents say, well, that can seem really mean because I just keep telling my kid, do this, do that, do this, do that. Well, everything that I talk about is research based. So if you're going to say, if you want to be polite, you want to use please, say it first. Please put your shoes on rather than last, because sometimes we uptick. We say, put your shoes on, please. And then it sounds like a question. So saying it first makes it seem more like a directive. And then finally, if you're going to give explanations, give it before you issue the demand or after it's been completed. Why? Is because your kid wants to avoid. So if I say something like, put your shoes on, and they say, why? And I say, because we need to go to the store. What store are we going to? We have to go to the grocery store. Why do we need to go to the grocery store? We gotta we gotta get groceries for dinner. Why do we need to go right now? Well, we need to go right now because we need something for dinner tonight. And why do we need to get something for dinner tonight? Because I didn't do the shopping over the weekend, right? That why continues to put off following through versus put your shoes on. Why? So I'm at about 6 seconds, and around this point, people start to get uncomfortable with that silence. That's just weird, right? Your kid will get uncomfortable with that silence too, and they want to avoid it. How do they avoid that silence? They go and they do the thing. They put their shoes on. Great. Thank you for listening. We're going to the store. Now get into the car. Why? We wait again. They get into the car. I appreciate you following my directions. We have to get groceries for dinner tonight, but at this point, your kid has already done most of the work. All right. Commands should be avoided when a routine can be put in place. So when we can already get our kids scheduled for a morning routine or homework routine, we don't want them to come home and us to have to say every night, get started on your homework, get started on your homework, get started on your homework. Show me that it's done. Show me that it's done. Show me that it's done. Right? Because those are commands that can just be part of the routine. Same thing with bedtime. Um, it can also be avoided when we have other expectations and consequences that are established. So, for example, if hitting always results in a loss of a privilege in your home, you don't need to tell your child don't hit. You need to move immediately to that consequence. When to issue commands is when compliance is time sensitive. The thing has to happen now. That's a good time to use commands. What to do if commands are not followed. So the first question to ask yourself as a parent is, did I do all the steps? Did I say their name? Was I close to them? Did I use it as a statement? Did I tell them to do what to do? Was it a single step, and did I follow through with praise? If your answer is no, you got to try it again. Move closer to them. Say their name, right? If your command was issued correctly, I want you to wait 10 seconds, and then you kind of have two choices. When I work with parents regularly, we talk through the broken record choice first. Do that for a couple days. And then if you're not seeing compliance change, then we're going to move into what's considered a forced choice. So I have examples of those today. So, the example of our effective command is the parent is finishing making dinner and would like the children to come to the table. The parent is in the kitchen and the child is watching TV. Parent moves to within arm's reach of the child and then says, Joseph, turn off the TV. Notice that that's the first directive. It's not come to the table. It's stop what you are doing, right? If the kid listens, they have to manage their frustration. They have to listen. They have to follow instructions. So great. We're going to follow through with behavior-specific praise. Thank you so much for listening and turning off the TV. Notice that I said listening first. If they're non-compliant, great. No reminders. We're going to wait 10 seconds and reissue the demand and either implement the broken record or the forced choice. So here's what a broken record is. A broken record is you give the demand, you wait 10 seconds. And this is 10 full seconds. It's not 1, 2, 3, 4, 5, right? It is 1001, 1002, 1003, right? Do not count out loud, count in your head. Because we don't want your kid to listen based off of, you counting. We want them to listen because you told them something. If they listen, great, big praise. Really appreciate you listening. That was so great how you did it right away. If they don't, I want you to reissue the demand. If they still don't comply, you're going to wait that 10 seconds, right? And then reissue the demand. You'll do that for an entire minute. So you, in 1 minute, will have issued the demand 6 times. Okay? Your kid is going to feel really uncomfortable. They're going to say, why does this keep happening, right? If they do it on the second time or any time after that, we're just going to issue neutral praise. Thank you for listening. Once you've done that for a couple days, you can switch into something like this. It's called forced choice. So you give the demand, you say something like, turn the tablet off, right? You wait 10 seconds. Did they comply? Awesome. Really appreciate you listening and turning off the tablet off. If they do not comply with the demand, you have two choices. You turn it off or I turn it off. The forced choice, both outcomes are our choices. They're not their choices, right? You wait 10 seconds. If they don't turn it off, you turn it off. If they do turn it off, neutral. Thank you for turning it off, or thank you for following my instructions. This forced choice can also be things for You telling your kid, like sometimes kids, really struggle with um, their value, so use an inside voice, right? If they're out with friends, you have two choices. You can use an inside voice and be able to continue to play inside, or if you do not use an inside voice, you go outside. We don't want to go outside. Well, then they've got the choice of using the inside voice. If you want to use questions, right, to loop back to that, is when your kid actually has a choice. If you're okay with any of those responses, ask the question. You can ask questions when your kid's calm, during conversations, or to encourage problem-solving question or problem-solving behavior. When to avoid questions is when you're not offering choice. You already know the answer, or you're trying to make a point. A lot of parents that I work with will tell me that their kids lie. Their kids lie. I ask him if he has homework, and he says no, and he has homework. Well, if you know your kid has homework, why'd you ask him? Because there are kind of two options here for your kid. You say, "Do you have homework?" And he says, "No." And you believe him. And then he doesn't have to do his homework. He says no, and you don't believe him. And then you say, "Go do your homework." But what's going to happen if your kid says, "Yes, I have homework"? You're going to say, "Go do your homework." So the only option here where your kid wins is he says no or she says no, and you believe them. So if you know your kid has homework, there should be a homework routine in place, or you give the directive, stop what you're doing, like turn off the TV, great, get started on your homework, right? Or when you are trying to make a point. Kids with ADHD, they know when they messed up, right? They don't need it to be rubbed in their faces. But so many parents accidentally do this. We say things like, "What were you thinking?" Most kids' responses is, "I don't know." Right? It was an in the moment challenge. You know, why did you do that? What was going on? Who did you think, who do you think you are to be able to do those things? So I had some time in here, for some practice, but what I would really encourage you to do is take some time where you're actually mindful of this stuff. You know, pick a 5-minute period where you're going to actually kind of pay attention to you working on saying your kid's name, being close to them, giving a statement, telling them what to do, having it be a single step, and following through with praise. Pick 5 minutes where you're actually going to pay attention to that, because if you get good at it in 5 minutes, you'll start to get good at it across your day. But if you're like most parents that I work with and you just think, "I'll try to do it all day," it's not going to work, and you won't be paying attention to where you succeed and where you do not succeed. All right, so I want to talk a little about my practice just so that people are aware, right? I do offer individual therapy for adolescents and adults. So individual therapy is pretty much only recommended for these two populations, right? If your kid is under the age of 12, it's starting with parent coaching or behavioral therapy, like I talked about. I also have some group therapy, right? So parents only session for understanding and managing ADHD, some academic stuff for kids. I also do school consultations. So if you are interested in some of this stuff, definitely follow me on Facebook and Instagram. But I really appreciate the time and would love to, kind of stop sharing, and maybe we can then talk through some uh, of the questions. I know the first one that someone had was what to do with your kind of teenage boy and school refusal. So, I think there's a lot of things for me to say, well, I would really want to know what all is going on, right? So things like, does your kid actually end up getting to school, or does he just stay home? If they do stay home, what are they doing all day? Are they able to be on the internet? Are they able to be on video games? Are they able to be on all those things? Because if so, that's pretty great. And I would avoid going to work if I got to stay home and get paid even more money, right? So for your son, you know, I would encourage you to think about, how do we motivate the appropriate behavior rather than try to punish the disruptive behavior. You know, if he's a teenage boy, he's likely sleeping in. You know, he's trying to have you manage his time and his efforts, right? So, some things I do think to keep in mind as parents is, even though you've given something to your child, that is still a privilege for them to continue to be able to use it, right? You pay the electricity. So maybe they don't get to keep playing video games because you're not going to pay the electric bill for that, meaning they don't get to use it. Not that you're just not going to pay your electric bill. Or just because you've given them a phone doesn't mean that it's theirs all the time. They earn those privileges by showing you these specific behaviors, by being responsible. Going to school is a part of being a kid. And when a kid uses their responsibilities, then they get the typical kid stuff, right? Um, so, in terms of school refusal, I think other things to keep in mind is a lot of parents talk with their kids around school refusals, right? And we talk and we talk and we talk and we talk and we talk, and that's what your kid wants. People with ADHD or kids with ADHD in particular, like I said this at the beginning, they have one play, and that play is to confuse you. Because when you're confused, you're responding to them rather than acting out your plan. So, you know, a good example of that is you say stuff like, okay, starting tomorrow, if you do this routine that we set up, you'll earn your free time at 8 o'clock, right? And what's going to happen is a kid who's not motivated to do this stuff, 8 o'clock's going to happen. And you're going to say, because you didn't finish your routine, you don't earn the stuff. And they're going to go, that started today. And you, as the parent, are going to go, we had this conversation last night. We talked about it again this morning. How did you forget? Oh, well, I thought you meant it was starting tomorrow. They're trying to kind of keep you confused. Meanwhile, they're doing the other play, which is to suck you into this whirlpool. So what happens? Oh, I don't know. How do I go to my regular whiteboard? I won't pull that up, but their goal is to kind of pull you into a whirlpool. It's harder and harder to get yourself out the closer you are to the middle because you're more wrapped into it. You're more um, kind of emotional with it. And instead, our goal is to pull out. That started today? Yep. Go get your teeth brushed. I know, I know. I don't need you to tell me anything. They go and they do it. They come back. Great. Thank you for listening. If they don't do it, we move back into our second play, which is we say it again in 10 seconds, right? You know, so I think, in terms of, school refusal, I think can also be tricky. Sometimes it's what's going on at school too. Are there certain kids or certain teachers that have negative experiences with your child there that your kid doesn't want to be there? Has your kid kind of been made to be the bad kid at school, which is often something that follows kids with ADHD? Um, if so, I wouldn't want to go to work if I was the bad employee there, right? I'd want to go if I was at least a neutral employee. So I'd need to know a little bit more to kind of talk through specific recommendations. And I would say, um, making sure that you have a clear understanding of all these things, right, that are going on, and then work with a provider maybe to get specific um, answers. The next question says, what about elopement? Another great question. And I think, again, I'd want to know more about things like where is the elopement taking place? Is it taking place at school? Is it taking place when you're out in public? Is it taking place, from your own home? Your kid gets mad and runs out your front door. Um, if it's a safety type issue thing, generally I recommend um, in your home they have these like door alarms. So that way, if your kid does get upset and they leave the house, you know immediately. If you're that concerned about your kid leaving the home. Um, but we want to make sure that we're motivating the appropriate behavior. So it might be things like how do we make sure that we're motivating and reinforcing them staying calm, them managing their emotions, them asking for help. Okay. If it's elopement from school, how do we motivate them staying in the classroom? If you stay in the classroom and do these types of, follow these specific rules, then this is the reward at the end of this. Elopement, keep in mind, is an attempt to escape or avoid. A lot of schools too will only use tangible rewards. So if the kid, stays in class, then they get to play on, the computer, or then they get to have more recess. Sometimes we have to motivate behavior through avoidance. If you stay in this class, this hour-long class, if you stay in this hour-long class for 45 minutes, then you can leave for the last 15. You get to go down and talk to, you know, the emotional support, person, a counselor, whomever it might be at your school. If you stay in this class for the first 45 minutes, then you get to go shoot hoops in the basketball court. But it has to be that we're making sure that we're motivating the desired behavior rather than solely just trying to prevent the disruptive behavior. Again, we can't just be reactive, we have to be proactive. Have I worked with divorced parents? Yes, I have. It works best when you have both parents wanting to be involved in the care, right, of their child, because then both parents can parent in the same way. So specifically, even if we're talking about like just two households, if any parent or any, caregiver that's involved in this child's life comes to the sessions, great. We can get everybody on the same page. You'll see behavior improve across both settings. If only one household shows up, what you'll see is the child's behavior improves in this household and it doesn't improve over here. But what starts to happen is if this is Monday, Tuesday, Wednesday, and this is Thursday, Friday, and some weekends, you'll see that whenever they come back to this household on Monday, there's more disruptive behavior, and you kind of have to get back into the plan, right? So when you have both households or multiple caregivers on the same page, that helps. This is also why sometimes, schools will say things like, you know, he's doing really well at school, but I'm not sure why he's not doing well at home. Well, sometimes school's more structured, so that might be why your kid's thriving at school but struggling at home. It's also the opposite. Sometimes the kid's doing really well at home and they're not really doing well at school because the school isn't the type of structure that your kid needs. When parents say, what type of teacher or what type of school should my kid be in? We want both parents and other caregivers to be firm and loving, right? So there's kind of this spectrum of schools that I talk about. Over here, we have crunchy granola, hippy dippy type style, right? Over here, we have army sergeant, drill sergeant style. Neither one of those is going to work well for a kid with ADHD. What works well for your kid is right here. Someone who has clear expectations, but also dotes on your kid really well when they're doing well. So we want something that's in the middle. Okay. Same thing for you all. All right. Let's see here. There's the sign in. So if you didn't sign in, make sure you sign in. Okay. Our 6-year-old, ADHD son is in kindergarten. We feel like he may be ready to start taking care of most of his morning routine on his own. However, his 4-year-old ADHD brother in preschool is not ready and needs a lot of attention and reminding. Is there an effective approach you can recommend to allow our older son to practice his independence with us still being able to fully assist his brother? Only one parent's available during most of the routine. Great question. I think this is where, you hear a lot in kind of ADHD communities about kind of like meet the person where they are, and like don't have such high expectations for, what they might not be able to do. In terms of your 4-year-old might not be able to complete all the steps, but they might be able to complete some of them. You know, 4-year-old can probably eat breakfast, right? So still having to check the box of eat breakfast. 4-year-old might kind of brush their teeth or do most of the brushing of the teeth. Great. Maybe you have to check to make sure it's done. But maybe you're helping them button buttons or, kind of make sure the t-shirt's on correctly. Okay, you can have, here's the 6-year-old's expectations, here's the 4-year-old's expectations. When they're done, then they get to move on to the stuff. And they both get to move on at a certain time. When your 6-year-old inevitably says, but how come I have to do this and this and this? He or she is trying to suck you into that whirlpool. Because if I say, because you're older, they say, but that's not fair. And I say, but it is fair. And they say, no, I don't want to do these things. And you say, yes, you have to do these things, right? You're back in that whirlpool and you're getting frustrated. Versus they say, I don't think I should have to. Okay. I wait. They have until 8 o'clock. If they get that stuff done, they earn their privileges. They earn their free time. If they don't, then they don't. And that's okay, right? Because again, then they're problem solving. They then have to problem solve their frustration over the fact that they have more responsibilities because they're 6 and not 4. Um, Sometimes parents will also ask me, well, what do you think about, in terms of routines, having a schedule, right? A visual schedule of the routine, like, actually writing out, get dressed, brush teeth, whatever. I'm okay with them. I think that they can be helpful, but I think what happens for a lot of families, um, they become the first thing we blame when the routine's not working out. Kid doesn't finish the routine by 8 o'clock, and I say, "Well, were you checking their schedule?" And they say, "No." And I say, "Well, what if we move the schedule from the refrigerator to your room?" "Yeah, yeah, I think that would work." Okay, and then they're still not doing it. And then we say, "Well, what if we move it from there to the bathroom on the," and they're still not doing it, right? If they're not doing something, it's likely because the motivation isn't there or the skill isn't there, right? Checklists are helpful when the main thing is forgetfulness. However, in a morning routine for most kids, they're not forgetful about what they have to do. They just want to engage in other more fascinating things. They want to watch TV. They want to play in the sink. They want to, play with their stuffed animals or draw or be on their phone or talk with their friends or whatever it is. They don't want to do their routine in that moment. All right, this has been wonderful. Thank you. Um, can you speak to trying these strategies when one parent also has ADHD and shares some of the same skill deficits as the child? Well, you're not alone, because ADHD is genetic, it is heritable. So, generally when a child has ADHD, one or both parents is likely to have ADHD. Um, and I think that's really important to know. And, when you share that with your clinician, it's what are the struggles that you're also having? If you're having time management struggles, well, you have to think about it as you practicing this as well. So if you're going to hold your kid to an 8 o'clock cutoff, how do you help set yourself up for success? Maybe the first couple mornings, it's instead of rolling out of bed when your kids roll out of bed, you wake up 10 minutes early. And does that stink to get up 10 minutes early? Yeah, but we're going to work on this short-term solution for a long-term gain, you know. The number one strategy that I have to be better at time is get more analog clocks in your home. The world used to have analog clocks, and now we have very few analog clocks. Analog clocks actually help you see the visual representation of the passage of time. Digital clocks, you don't see it. You say, "Oh, it's 8:17 right now. I have until 8:30." Okay. But when you see, "Oh my gosh, that time is kind of dwindling down and dwindling down," it can make it a little bit more challenging. Um, other things I think that adults, with ADHD struggle with is kind of executing right in the moment. And when you meet with a provider like me, we talk about this is the script. This is what you say. Great. It's also about practicing it. We run through examples, that back and forth of do this, why? Do this, why? Do this, why? That's a practice. You tell me to do something as we're working together. I try to distract you. I try to confuse you. I didn't know I needed to do that. And we wait to see if you respond because when you practice it outside of it, you'll be much better in the middle of it. Often adults with ADHD too struggle to manage their emotions. And we also talk about how do we help keep you neutral so that your kid is neutral? Well, you're going to be better able to execute this when you have a plan. When you know that you're not going to 10 reminders, you're going to two. You don't get upset as much. You're able to manage your emotions. You're able to deliver it in a neutral tone rather than, "I told you you needed to do this," right? You become the parent that you want to be. Um, all right. I like the language of earn. Great shift. Thank you. Yes, I think that's super important. Earn. This is the hard work that they're putting in here. Um, I also don't necessarily like to use lose, right? So in the morning routine, they haven't lost anything yet because they never had the chance to get it. So I just say you don't earn. You either earn it or you don't earn it. I earn my paycheck or I don't earn my paycheck. No one's taking money away from me, right? Thank you. Interesting about the clocks. Yes. Super helpful. Um, putting them in common areas too, kids' bedrooms, things like that. Um, even with alarms. So again, back to this teenager who's maybe like not waking up. Um, so many people these days stick to using their phone for their alarm. And where do you keep your phone? You keep it right next to you, probably for like most adults or most teens. So your alarm goes off, boom, you hit snooze. Because right there, it's super easy, you know. Um, I don't know if you remember those like, analog clocks where they had the actual like bell on the top and it would kind of like ring back and forth. If your kid struggles to get out of bed, buy one of those, put it across the room. Why? Because then your kid has to get up out of bed and they have to move across the room and go turn it off. If they then get back into bed after that, come back and talk with me, and I work with people on sleep, right? Okay. Can you speak about PDA, pathological demand avoidance? I can. I think PDA is something that we as a field are continuing to learn more about. A lot of the research that's being done on PDA is done over in Europe, specifically, I believe, in the United Kingdom. We Myself as a clinical psychologist, I cannot bill my services under PDA. So I would have to bill it under something like autism, or I would have to bill it under something like ADHD, or disruptive behavior or something like that. Generally, here when it's being diagnosed under the umbrella of autism, or that's where I've most commonly seen it as. And I would say in terms of managing it, I think there is kind of a misconception out in the general public that the goal is to remove demands, that we just get rid of demands for these kids. And I think what people are hearing is you have to kind of stop telling them to do stuff. And that's not helpful, right? That's not going to help them be, just people of society who don't get frustrated when they end up having to complete demands that they don't want to do. I think the more important part is removing all of the unnecessary demands. So, like I said, the purpose of a routine is so that you don't have to keep telling your kid multiple times a day that they have to do something, right? They kind of know when they're on autopilot. That goes along with the PDA, right? If a parent gives 100 demands and their kid generally listens to 10 of them, well, we can cut out probably 50 of those demands when we put routines in place. And now we've only got 50 demands, and your kid is now listening 20% of demands instead of just 10%. And the goal is you working with someone to find out what demands are actually imperative and what are not. What things need to be met, and how can we say things in different ways. Another technique is something called when, then, or if then. It's what a routine is based off of. When you do these steps, then you earn your free time. Great. Can I have a friend over? Sure. When you clean your room, then you can have your friend over. I don't want to clean my room. Now, upsets and frustration are something that, need to be managed in a different way. And we don't have time to talk about that today. But okay, we don't have to give them the demand to clean their room. They get to move on to the thing that they want to do when we get a little bit of what we want to do. Okay. Hopefully that answers the question about PDA. I love the idea about a clock with bells, but my child would and has them broken the alarm clock immediately. Ideas. Yeah. If your kid's destructive, intentionally or unintentionally, generally there should be an immediate consequence for that rather than discussions about how you can't do this. I find that funny that, many parents that I work with will say that they often tell their kids that they cannot do something. And you know what your kid's thinking? I can. I just did. Right? That'd be like me speeding and getting to work safely and someone saying, you can't speed. Well, I just did, and I got here successfully. Like, you can't break things. I just did. You can't talk to me that way. I just did. Um, did you say your office accepts insurance? I know a lot don't. So I don't have an accept insurance. I will create super bills, and I do offer a sliding fee scale. So, I work with a wide range of families. So if you are interested in working with me, please reach out. I know, unfortunately, Children's Hospital Philadelphia used to do a lot of treatment, and I think it's because of just some issues with insurance. They have drastically decreased their insurance. Their treatment. And I do also offer groups. So, for some families that can be helpful too. Can elopement be about impulsivity? Impulsivity? If so, what to do? Yes. When I talked about like it being a way of avoidance, it's still an impulsive way of avoidance. At the beginning of this talk, I talked a little about how kids' brains are kind of like Ferraris, or people's brains with ADHD they're like Ferraris, 0 to 100, super fast, right? Our job is to set down these speed bumps for them. So, we're not gonna get them to just stop completely. Our goal is to get them to speed, 0 to 20, and then have to slow down to get over the speed bump, and then 0 to 20, and then slow down to get over the speed bump. So, sometimes they do it because of reasons, though. You know, they're having a poor difficulty managing their own frustration. They don't like what they're doing. They, don't know how to get what they actually want out of this. So, all right. I think I got through everything that's in the chat. I know we have a couple more minutes. I'm happy if somebody else wants to drop something in the chat. Otherwise, I'm happy to, turn it back over to the Chad administrators.
Um,
Oh,
your
my contact
oh,
info.
requested, yes.
So my contact info, if you search my website, it's midatlanticadhd.com. My email is my first name, Craig, dot my last name, Sidol, Sidol, at midatlanticadhd.com. And my phone number is 610-915-8819.
Thank you so much. This was awesome. There's so much information. And thank you, because I didn't even stop the recording. So we got the questions on the recording as well, which is awesome. So our next meeting is May 15th. And we actually have someone who's going to be talking about pediatric sleep and ADHDs, which we had booked before we met. So that's also one of Dr. Craig's specialties. So if you are curious about sleep, or I don't know why they just turned off the light. If you're curious about sleep, that's what we'll be talking about next month on May 15th. So make sure you've signed in so you can get on our email list. And then I do have a suggestion for the person about the alarm clocks. There was one on Amazon, I don't know what it's called, but it has a piece that goes under the mattress that vibrates. And then it has the alarm itself. So it has enough of a cord that the alarm is away from the bed. So I do have two children that one is for sure has ADHD and the other one is suspected to have ADHD. The ADHD child definitely broke his, but the other one has not broken hers yet, and it's been working great. So it's probably worth looking it up and giving it a try. So if everybody is cool, if no one has any more questions, Dr. Craig, this was amazing. Thank you so very much. I'm gonna stop the recording.